We want to welcome you all today. Thank you so very much for joining our presentation. We have a very informative session coming up, and I'm not going to take any more time than is absolutely necessary to dive into this topic and introduce our wonderful special guest, Shana Scott, with the American Heart Association of Metropolitan Atlanta. As you all know, this is Heart Month, and so Hybrid Solutions is glad to host this presentation for you. As you can see on the next slide, we are bringing the health IT gap smaller and smaller so that we can have the secure exchange of interoperable information. Our presenter today, as we said, is Shana Scott, JD, MPH. She is currently the VP of Impact for the American Heart Association of Metro Atlanta, and as a public health leader, she has worked at the intersection of public health, law, community advocacy, and policy for almost 20 years. So it is with great pleasure that I introduce her and listen to all the great information she will share with us.
Thank you so much, Phoebe. Thank you for giving us the opportunity to present today. And thank you to Hybrid Solutions for extending the offer. As Phoebe mentioned, we are in the midst of American Heart Month. And so today I wanted to just share a bit of information with everyone. Today I'm going to be talking about heart disease and stroke. We'll start with why it even matters, why should we care? And most importantly, what are those warning signs? And then as the presentation title, what are some of the clinical programs that the AHA has to offer to address heart disease risk factors? And then we'll have opportunity for question and answer. And so you all may already be familiar with the Metro Atlanta American Heart Association, who we are. Our mission is to be a relentless force for the world for longer and healthier lives. And so our work is very important when we think about the social determinants of health and how there's this data that says 80% of your health is determined by where you live. And so when we look at Georgia specifically, and data around lack of access to health insurance, lack of quality food, clean air, drinking water, employment, housing, et cetera, being able to partner with providers such as yourself and organizations such as Hybrid Solutions to share resources is very important to us. And specifically, our team is in Metro Atlanta. And so I wanted to share just some information about equity in Metro Atlanta itself. This can be extrapolated for any of our communities across Georgia, but we know that when we look at these areas, these are the priority areas for the American Heart Association, specifically looking at community need. We know that Georgia holds the third highest percentage of uninsured residents in the country, where almost 1 in 5 Georgians lack health insurance. And then from a nutrition security perspective, over half of our students in Metro Atlanta rely on free or reduced price meals at school, and most live in areas with little or no retail healthy food access. And that data may be even more staggering if we are looking at other areas of the state, such as our southern pockets and our northernmost pockets. And then from a clinical perspective, blood pressure management is one of our priority areas, and I'll spend most of my time talking about blood pressure and hypertension and cholesterol today. But we know from the data, 1 in 3 adults in Metro Atlanta have high blood pressure, and then across Georgia, 1 in 3 adults have hypertension, and many people don't either have their hypertension under control or don't know that they actually have hypertension. And then additionally, tobacco use and vaping. The smoking rate in Georgia is at 12%. We are doing well, but we do still see that 1 in 4, the smoking rate in Georgia for adults is about 14.5%. But then for tobacco use and vaping, we do see that 1 in 4 of our students are vaping or are now regular vapors than smokers. And so I talked about our priority areas. This visual just hones in a little bit about how we are actually, addressing community need, addressing tobacco use and vape, and controlling blood pressure and the nutrition security. And then, of course, mental well-being and reducing risk for women. I've already talked about a little bit about our 2024 impact goal, but really our priority is looking at ways that we can address those drivers of racism. What are the things that we can do to impact those drivers of racism, and how can we partner with organizations to address those areas? And so I mentioned I'll spend most of my time talking about high blood pressure, hypertension. But before I even get into that, and we know hypertension is a risk factor for heart disease. Heart disease is the #1 killer of adults in the United States. It's the #1 killer of adults in Georgia. It's the #1 killer of men, women, African Americans, et cetera. And so we want to look at that information, and why that is important. And then looking at stroke, stroke is the #4 killer of adults in the United States. And I'll say in Georgia, depending on race, this number may fluctuate between #4 and #6 killer of our Georgia residents. And so why are we having a conversation about heart disease? What is heart disease? Many of you all are clinicians or work in some sort of clinical capacity, but heart disease, in simple terms, it describes several types of problems related to the heart. We also use the term cardiovascular disease, which are those diseases that involve the heart or blood vessels and conditions related to that. This slide just goes into several of the types of heart disease that may be impacting our population. And so I'll pause, and if you all can maybe put this in the chat. Oh, I'm sorry, I'm just looking in the chat. If you all can okay, I see the questions coming through already. When it comes to heart attack warning signs, men and women can experience different symptoms. True or false? So I'm going to try to navigate the chat as well. I see some folks coming. Yes, true. Men and women do experience different symptoms from heart attacks. And so here are some of the warning signs that may be across both groups. So chest discomfort, lightheadedness, jaw, neck, or back pain, discomfort or pain in the arm or shoulder, shortness of breath. And so this slide, you'll see the symptoms for men as well as women on the right-hand side. And what we want to encourage people is that when any of these warning signs occur or appear, the first thing to do is to call 911 if you are having any of these signs or symptoms. And so again, the heart attack warning signs that we've already addressed on the previous slide, and the difference. And so we'll move on to stroke and look at what a stroke is and isn't, and the various symptoms. And so a stroke is a brain injury. It is caused by when the blood vessel becomes blocked or it bursts and cuts off blood flow and oxygen to the brain. Like the heart attack, there are also different types of stroke. And so the majority of strokes that people have, 87%, is what's called the ischemic stroke, which is the blockage. It's caused by a blockage or a clot in the blood vessels of the brain. Or you may have what is known as the hemorrhagic stroke, which is about 13% of individuals have that type of stroke, which is caused by a burst or a leak in blood vessel in the vein. The next slide just goes into a little bit more scientific details about the various types of stroke. The ischemic stroke can occur at fatty deposits which then line the blood vessel wall. And you'll see the different types of deposits and what is occurring to potentially cause a stroke here. The hemorrhagic stroke, again, is when that weakened blood vessel ruptures, and you'll see from the visual, the normal artery, the weakened artery, and then that ruptured artery, which then hemorrhages to cause the hemorrhagic stroke. And then other types of warning strokes or warning signs, TIA, the transient ischemic attack, is a warning stroke that can happen before a major stroke. And in this particular situation, the blood flow from the brain artery is briefly blocked or reduced, and you may have temporary symptoms, but they are similar to those of a stroke. And a TIA is a medical emergency, and we would want to call 911. So pause for me talking and then engaging in the chat. When it comes to warning signs, what does the acronym FAST stand for? What does FAST stand for when we are discussing strokes? All right, well, FAST stands for face, arm, speech, and time. So these are the things that we would like for you to recognize. Face, if a person were experiencing a stroke, there's face drooping. So does one side of the face droop or does it become numb? Arm weakness. So I'm able to move my arm up. If I were standing giving this talk, I probably would be moving my hands around a lot. And so would my arm become weak or numb? Speech difficulties are S. Has my speech become slurred? Or am I now unable to speak, or is it hard to understand me? And then the T is about what we do if we recognize any of these three signs, and that is time to call 911. So if a person shows any of these symptoms or signs, even if the symptoms go away, you want to call 911 and get them to the hospital immediately. And so in looking at a sudden stroke warning, again, numbness or face weakness, arm or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance, or coordination. Severe headache with no known cause. I'll go back 1 second, sorry. And this is just not for older adults. A stroke can happen to anyone. We have survivors that are a part of the American Heart Association, American Stroke Association, that are as young as 15 years old who've experienced strokes. And so we want to ensure that we are cognizant and we are able to recognize these signs and symptoms. Again, just like the heart attack, we may have some different warning signs for men versus women. Women make up nearly 60% of all stroke deaths. And we do know that, again, stroke is a leading cause of death and disability in the United States. And women make up nearly 60%. But why? Why? Well, women, again, may have some different symptoms. So I remember FAST, right? FAS. But then women may have fatigue, confusion or disorientation, weakness, exhaustion, nausea or vomiting. And so a woman might confuse these as regular symptoms of maybe their menstrual cycle, just exhaustion because they're a mom. They may have busy careers. And so they may not recognize that these could be potential signs of a stroke. Women also may misunderstand the symptoms and hesitate to bring it to a doctor's attention or even call 911. Women may disregard something like a sudden, unusually bad headache if they generally always have headaches. And so it is critical to zero in on any sudden symptoms or loss in function that you cannot explain. And the key is that it is sudden. And so the T of of fast is very important because it wasn't that long ago that, you wouldn't be able to tell if someone had a stroke. It wouldn't really cause, um, you wouldn't be able to manage the disability. And so now we know that strokes are preventable, they are beatable, and they are treatable. And so time is very important. And more people are surviving and beating strokes. So every second counts. So we'll look at the risk factors for the two pieces that we just talked about, stroke and heart disease. And so there are varying risk factors. There are things that we cannot change, right? We cannot change who the families we were born into and who we are. We can't change our age, our gender, our race. We can't change if we have chronic kidney disease or an existing medical condition that is not able to go away. But there are other things that we can change, like our diet, our physical activity, being overweight, too much alcohol, lack of sleep, our cholesterol, diabetes, our smoking status, and we can reduce our stress. And so other risk factors, again, if you are not a drinker, don't start. If you do drink, do so in moderation. If you are not a drug user, don't use drugs. Illegal drugs do impact the cardiovascular system. Opioids are also linked to an increased risk of stroke, and work on our stress management. Stress increases our risk for heart disease, diabetes, hypertension, disability, substance abuse, and premature death. And so moving on to high blood pressure. And again, I mentioned that that is a risk factor, and just some data across the populations when we talk about high blood pressure. High blood pressure is that force of the blood pushing against the walls of your blood vessels, and is consistently too high. Nearly half of the people with high blood pressure do not have it under control. Oops, excuse me. And so I've already gone through that. Ensuring that the patients that you work with, they know their numbers and they understand what their numbers mean. And it's not just about them saying systolic over diastolic, but they are actually aware of the meaning of the numbers. So our top number, the pressure as your heart beats and the force of the blood moving through our arteries. And then that bottom number is as your heart relaxes in between the beats, how is your heart relaxing? All righty. Another moment to answer a question. Is it easy to spot someone with high blood pressure? All right, I see the false there. See some no's. No, that's correct. False. It is not easy to spot someone with high blood pressure, and many people don't know that they have high blood pressure. More than 500,000 deaths in the United States occur as a result of hypertension being a primary or contributing cause. Uncontrolled hypertension is common. Certain groups of people are more likely to have high blood pressure. A greater percentage of men, 50% of men have high blood pressure than women, 44% of women have high blood pressure. And high blood pressure is more common in non-Hispanic Black adults than in non-Hispanic white adults and non-Hispanic Asians or Hispanic adults. So let's now take a look at some of the facts around blood pressure and better understand what is happening. So this is just the various blood pressure categories. So ensuring that your patients know their numbers and hopefully they are in that normal range, and you'll just see what is happening in each of the different ranges. Elevated is when the readings are consistently ranging from 120 to 129 and less than 80. People with elevated blood pressure are likely to develop high blood pressure unless steps are taken to control it. Hypertension stage 1 is consistently ranging from 130 to 139. or 80 to 89 diastolic. So now we'll see stage 1, it is not a and, but it is a or for our systolic and our diastolic numbers. And similarly with stage 2, it is a or 140 or higher. And at this stage, doctors are likely to prescribe medication or along with lifestyle changes. And then hypertensive crisis is when the blood pressure requires medical attention. If your blood pressure readings suddenly exceeds 180 over 120, you would wait 5 minutes, test again. If your readings are still unusually high, contact your doctor immediately because that person could be experiencing a hypertensive crisis. And just the consequences of high blood pressure, which of course you all are familiar with these: kidney disease or failure, left uncontrolled or undetected. High blood pressure can damage the arteries around the kidneys and interfere with the ability to filter blood. Vision loss, high blood pressure can strain or damage the blood vessels in our eyes. This can also lead to erectile dysfunction in men or lower libido in women. High blood pressure can also cause a narrowing of the arteries in the legs, the arms, the stomach, and cause pain or fatigue. And then peripheral artery disease, which is what I just described. Angina, which is what I didn't describe, was the heart disease or microvascular disease, or chest pain is a common symptom, excuse me. And then, of course, heart attack, which is preventing the blood flow to the tissues in the heart muscle, and then heart failure and stroke, as we've talked about before. And I won't go into all of the details on this slide again, because we've talked about that. And then, you know, every time your blood pressure goes up by 20 over 10, your risk of heart disease doubles. And we know that heart disease is that leading cause. And then we talked about those risk factors earlier, the things that you cannot change: your physical risk factors, your family history, age, gender, race, etc. But then our modifiable risk factors, things that we can do to prevent and manage our high blood pressure, including increasing our physical activity, adhering to a healthy diet, the DASH diet or a Mediterranean diet, or one that is lower in sodium and processed foods. We can reduce our alcohol intake, address our sleep apnea, our high cholesterol and diabetes, and stop smoking. And so the following slides will just talk about some of the modifiable risk factors, including the ones that I just mentioned. And so when we are talking about physical activity, we want to ensure that we are providing our patients with the details about how to engage in as much physical activity as possible. We know that physical activity lowers our risk for blood pressure, our risk for stroke, any muscular or cardiorespiratory fitness, it improves, and it helps us to maintain a healthy body weight and prevent falls as we age, and improves our mental health and our cognitive health and sleep. And so the recommendations for our patients is these are not and. So 150 minutes of moderate intense aerobic activity, 75 minutes a week of vigorous aerobic activity, or a combination of the two. And then from the dietary perspective, ensuring that we are adhering to a healthy diet. So a healthy diet helps reduce those risk factors that we talked about. So we want to reduce our risk for high blood pressure, cardiovascular disease, diabetes. And so regardless of our genetic predisposition, your diet and your lifestyle does have a huge impact on your blood pressure, and your heart health. Yes, 10 minutes of exercise a day can make a significant amount of difference. Thank you for that. And then as we're continuing to talk about a healthy diet, drinking plenty of water, limit our intake of sodas, juice, and other sweetened, sugar-sweetened beverages, reduce our fat intake. So choose your fats wisely, and ensuring that we are choosing complex carbs, whole grains, whole fruits, vegetables, legumes, and our complex carbs are important. All right, more chat box time for you all. The American Heart Association recommends eating no more than 2,300 milligrams of sodium per day. How many teaspoons is 2,300 milligrams of sodium? How many teaspoons are we talking about? Ooh, I see 3, 1. Hey, Tamina. I feel like Tamina may know this because I gave a similar talk to her group recently. Okay, so 1. So the answer is just 1 teaspoon. The AHA is actually encouraging all of us to eat less than that. So 1 teaspoon is 2,300 milligrams of sodium. And so the recommendation is less than that, no more than 2,300. Okay? So added salt, what about added salt? So no, this is not even just added salt. This is just your recommended amount per day. So what we know about salt or sodium chloride is that it can impact our blood pressure greatly. It is not the only thing that can impact our blood pressure, but it does, as sodium accumulates, the body holds on to more water. And so that increases our blood volume. And so our heart is working harder and there's more pressure on the blood vessels than would be without that salt in our diet. So again, the AHA recommends our adult intake is less than 2,300 milligrams of sodium per day. We only need 1,500 milligrams for our vital body functions. And most Americans consume about 3,400 milligrams of sodium per day. Can we believe that? Almost 1,000 milligrams more than the recommended intake. So now we're moving on to tobacco use. So if you don't smoke, don't start. Quitting has immediate benefits, as you all may be aware. Your body heals yourself after you quit. And this slide just goes and talks about some of the benefits of quitting at different phases of life. So the number that is ideal for cigarettes is 0. The ideal number is 0. You've never smoked a day in your life. But if you have smoked or if you smoke now, you can always improve your number by quitting today. So in just 20 minutes, you are already having positive health effects. This is the biggest one where a lot of folks are like, okay, I just can't do it. I just can't do it. And so stress is also an impact to our heart health. The more stress you experience, the more of an impact this will have on our bodies. And so we can lower our stress. Stress can contribute to our health. Stress is high. It's more, if you are already smoking, you are more likely to smoke more or overeat more, or then have less physical activity, an unhealthy diet, which could cause you to become overweight. And then you may not take your medications as provided. And so we fight stress with healthy habits. Healthy habits like getting enough sleep, practicing relaxation. Adults should aim for 7 to 9 hours of sleep each night. Yes. Practice relaxation, meditation, deep breathing, mindfulness. These are all great ways to fight stress and induce a calming effect on your body. Give up bad habits. I know that is so hard, but alcohol, tobacco, caffeine can increase your blood pressure. So cut back or quit to reduce anxiety. And then I won't go through all of these. Maintain a positive attitude. If you are feeling overwhelmed, there are many treatment options available, including speaking with a mental health professional or taking prescribed medication. So regardless of any of these unhealthy habits, sometimes you may feel like you have too much stress to handle on your own, and that is okay. If you are feeling overwhelmed, there are options. All right, and so now if you already have hypertension, we want to take our medication as provided. So typically, those who are prescribed medication is if their blood pressure is at 130/80 or above. And so we want to ensure that those who are at that blood pressure, they are taking their medications as prescribed. Some doctors may prescribe earlier for people in high risk groups. And when I say earlier, I mean a different blood pressure. Excuse me, I didn't mean to say earlier. A lower blood pressure than 130/80 if that person is in a high risk group. For example, your doctor may prescribe if your BP is 130/80 and you have health problems like diabetes or kidney disease. I am not going to demonstrate the taking of the blood pressure today for obvious reasons, because I can't take my own blood pressure and demonstrate it accurately per the visual here. However, we do have these visuals that we can provide to Highbridge to give out, or you all can contact me. These are visuals that you can put in your screening rooms, in your waiting rooms. We provide training around just the refreshers around the accurate taking of the blood pressure. And so just a bit of information on the screen about things to keep in mind. Emptying the bladder is very important. Do not talk during the measurement, and ensuring that you are using the correct cuff size for your patients. And so confirming that you have an accurate blood pressure, ensuring that they have rested for at least 5 minutes. So I know sometimes patients are like, oh, they had me waiting in the waiting room for so long. But that wait is good because we want to ensure that they are rested for at least 5 minutes. However, hopefully that wait doesn't cause too much anxiety and then increases that blood pressure. But obtain the average of at least 2 to 3 measurements, and then wait 1 to 2 minutes between each reading. And if the readings are high, ensure that they are speaking to their provider. And just some of the things about, well, how inaccurate can the blood pressure be if my legs are crossed? So you can see it can increase by 2 to 8 millimeters for that reading. If my cuff is over my clothing, 5 to 50 milliliters per mercury. Wow. Too small, 2 to 10 millimeters. If my bladder is full, 10 millimeters. If you are talking or active listening, again, 10. And if my arm is not supported, 10 millimeters per mercury. And if my feet are dangling from where I'm sitting or my back is not supported, 6.5 millimeters per mercury can impact my blood pressure reading. All right. Another moment to provide some information in the chat. So what are some things that can impact the accuracy of your blood pressure reading? What are some things that can impact the accuracy, excuse me? Yep, white coat syndrome, because I am stressed out, how we're sitting. Yes. Yep, all of those things. All right. So I've shared a lot of information about, heart disease can impact our populations, hypertension, not knowing, stress, stroke, etc. Well, what can the American Heart Association provide to you all as clinicians, providers, nurses, etc.? We have our Outpace CVD initiative, Outpace Cardiovascular Disease, and it is a wealth of resources that you all can utilize to reduce cardiovascular deaths, heart attacks, strokes, hypertension in the populations that you serve. So from our Outpace CVD package, we have 3 opportunities: Target BP, which many of you may already be participating in. We have our Target Type 2 Diabetes Initiative, and we have our Check, Change, Control Cholesterol Initiative. So I'll just spend a few minutes talking about the 3 and then offer some time for some question. It is in collaboration with the American Medical Association, and it provides an opportunity for physician practices and health systems that treat patients with hypertension, high cholesterol, and type 2 diabetes to, 1, work on managing and treating, and then being recognized for their commitment. And so that recognition is about your commitment to accurate blood pressure measurements. So related to the previous slide, improving your blood pressure control rates for your practice. So engaging with us around education, materials, tools, resources that would improve the blood pressure control rates in your practices. Identify and manage cholesterol and sustain those cholesterol control rates, and then providing evidence-based care for patients with type 2 diabetes. And so Target BP, again, it's in collaboration with the AMA, and the goal is to improve blood pressure control by urging medical practices to prioritize blood pressure, and we support physicians and care teams by offering access to research, tools, resources to sustain blood pressure control rates within the population. And it focuses on 3 areas of control, which is around the MAP framework, which is measuring accurately, and rapidly, and then partnering with patients around their blood pressure. And so measuring accurately, accurate blood pressure, accurate measurement, and then recording of the blood pressure is essential to get into that category, identifying where they land, to get their blood pressure related cardiovascular risk, and then to guide the management of that high blood pressure. The A, acting rapidly to address their blood pressure readings. So what are you doing to act? How are you taking control? What treatment protocols have you implemented to bring their blood pressure under control? And then partnering with the patient, their families, and the community to promote their self-management and monitor progress. So we provide resources and tools about self-management, managing at home, providing devices, procuring devices, all of those things. And so we have 6 evidence-based activities that we encourage providers to participate in when they are managing the blood pressure. So calibrating the blood pressure devices, we provide trainings on that. We provide education on achieving the blood pressure measurements and creating a system of care. And so there are a number of resources on our website, targetbp.org. You can download those tools and resources, but you can also connect with me one-on-one for in-person opportunities around positioning, using or implementing a treatment algorithm, and assessing where your practice is. And then the type 2 diabetes, targeting that, it's around controlling and measuring for all patients who have poor control, meaning an A1C over 9 and higher. And you can see the NQF and the MIPS numbers there. And so the goal rate of that is 25% or less, A1C poor control rate of 9 amongst all eligible patients from the previous calendar year. And then you all can work on a CVD risk management measure, and you would pick one, whether it is the statin therapy measure or the NQF 18, the blood pressure measure. And again, like Target BP, we provide a number of resources. You can see there, clinical trials, CVD case studies, CKD tools, DSME services, managing COVID with diabetes, and the A1C CVD app. And then cholesterol. This slide just shows some details about cholesterol, but the check change control is, again, a management and identification program. And like the other two, we provide clinicians and care teams with research tools, resources on how to manage hypercholesterolemia and provide the patients with resources to manage their cholesterol levels. And again, we have a variety of resources for people living with high cholesterol and for providers who are treating high cholesterol. And those resources are also on our website. And if I can share this with you all with the slides, but if anyone is interested in being recognized and participate in all of the initiatives, we can provide those details about how to register online. You would submit a brief amount of data, your total number of patients, how many people have X, what conditions, etc. And then there's a recognition program around the data submission. This slide just goes into the three various recognition programs, the data collection requirements, and how you all are recognized. There are different levels of recognition depending on what program you are participating in, and different recognition benefits, annual AHA, AMA recognition on our Target BP website. You all will receive a digital program seal, be listed in a national press release, various speaking opportunities to be a spokesperson for our local market, press releases, social media, etc., local recognition, and then the acknowledgement in our AHA journal. So that is all of the information that I have today. I will pause and see if there are any questions, but thank you all so much for the opportunity to share this information during Heart Month and share the resources that we have to offer to address hypertension, diabetes, and high cholesterol.
Thank you so much. We'd love to see if we can answer any questions for you. That was a tremendous volume of information, but the quality is also outstanding because, I was thinking through this, we all have a heart, and sometimes we take it for granted. But what you reminded us of is all the ways, all the resources, all the thought that we should individually put into taking care of this amazing organ in every way that we can. So does anyone have any questions? Please feel free to put them in the chat. We'll try to get to them for you. And here is contact information so that you can reach out and benefit even more directly and personally from the resources that are available from Shana. So thank you all so much for joining us. Um, it was really great. I need to take a lot of that information to heart, pun intended, personally. Um,
Well, you all have the slides, Phoebe, so feel free to put them in a PDF and share out to the group. And, if there are follow-up questions, they are more than welcome to contact me for any follow-up questions. I know I ran through it, and I have 14 minutes.
that I am amazed. I am amazed. Yes, what I would like to invite people to share in is the disability training that's available um, for any providers, any clinicians that would like to. It's available for continuing education credits, and it helps providers with connecting with patients who have disabilities. So I'm going to put that in the chat again. To make it a little easier, if someone isn't able to access the QR code, we also put the links in the chat, and we hope that you take advantage of that training as well. And we have our monthly webinars every third Tuesday of the month, and we invite you again to join us for the next one. We'll be sure to send out that information as soon as we have created it and made it available. Thank you again so much. That was an amazing presentation. Very, very practical. Really what we all need. And we hope you all have a wonderful day, and thank you again for joining us. Be well.